voice
Call
vote.
to order, stand for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Welcome, everybody. Tonight we start our interviews on our applications. First up will be Porter County Community Foundation. Just real quick, we'll go over the rules. You have 15 minutes to speak. Kurt will let you know when there's 5 minutes left, and then there will be 15 minutes for Q&A. Okay? And we'll start the 15 minutes as soon as you start speaking. So don't worry about it. It hasn't started yet, so you can come on up or however you want to set up.
Not to assume that we have to stay.
You don't have to. We can open the doors and stand out in the rotunda and yell at us.
Thank you.
Thank you.
Nice to see you again.
Anytime you're ready.
Okay, thank you for the opportunity to be here this evening. I'm Bill Higbee, President and CEO of the Porter County Community Foundation. This is Dr. Mary Jane Eisenhower, who is the almost 1 year now, has been the Executive Director of a new initiative called First Things First Porter County. And I'd like to set the stage about this initiative by telling you that it came about as a result of an invitation and sort of a call from Lilly Endowment to community foundations all over the state of Indiana to think about how they would execute some transformative work in their communities. And they left it up to every county, every community to decide what that work might be. So we launched into an extensive listening tour of Porter County. We spent several months doing that, listening to folks from all over the county. What are their concerns? What are their dreams? What do they love about Porter County? What are they worried about? And when we took all of that information and distilled it down, we looked at it through the filter of this question. If there were one thing that the Community Foundation, along with the community, could do with this opportunity from Lilly, what would it be? How could we make the biggest difference given this opportunity? And it all came down to early childhood development. So much occurs in the first 3 years of life that affects everything else about our community. So once we decided on early childhood development, we launched into a study period of all that early childhood development affects within a community. And it affects every aspect. All of the issues that we deal with as a community, poverty, homelessness, crime, domestic violence, child abuse and neglect, substance use, physical and mental challenges, all have their roots in the first 3 years of life. This was quite a learning experience for us. So armed with this new knowledge, we launched First Things First Porter County to really shift the culture of our community so that we put a stronger emphasis on early childhood, from prenatal to 3 years old, when the majority of our development occurs. So we want to focus on getting it right when it counts the most. And that's how First Things First came to be. Next slide, sir. I do want to assure you of these considerations that we were asked to report on. No issues from our standpoint on those ideas. Next slide. These are the 6 statistics that convinced me and ultimately the Foundation's Board of Directors that this was the right place for us to put our resources at this particular moment. If you look at the first one, 1 million new neural connections per second occurring in the first 3 years of life, the first from 0 to 3, 0 to 5, 1 million things happening in the brain every second. No wonder babies sleep all the time. They're exhausted. A lot's going on. 85% of our brain's development occurs in the first 3 to 5 years of life. If we don't get it right then, we have a lot of problems to try to fix later on. At 18 months, we can already detect gaps in vocabulary between kids who have been receiving the kind of stimulation and development and kids who haven't. In fact, kids whose parents are college educated know 3 times more words at 18 months than those kids whose parents haven't finished high school. Big difference. There is a nearly 100% chance that kids will experience some delay if they have risk factors like poverty, low educated parents, issues in the home, mental illness in the home, stress in the home. Nearly 100% of the time, they will experience a delay throughout their development. And it's more than just cognitive delays. If you look at the 3-to-1 odds, these stresses in early childhood are carried out into adulthood through our physical health. 3 times more likely for somebody to experience heart disease if they have had those early stressors in their first 3 to 5 years. And the economics are played out as well. For every dollar that we invest in 0 to 3, 0 to 5, we get $4 to $9 back as a community over the course of a lifetime. In fact, Dr. James Heckman from the University of Chicago his research has determined that for programs that start at birth as opposed to preschool, starting at birth, you get a 13% additional return above the $4 to $9. So there is really no segment of our community that is not affected by this first 1,000 days.
Thank you. So our proposal is to really take a look at those first days and months of a family's life with a newborn. We are asking for funding to begin the momentum of providing a universal home visiting plan for every single family. If one of the most transformative things we can do for our community is to start with those 0 to 3, within that 0 to 3 time frame, the research tells us that a home visitor can make the most impact. So what is a home visitor? That's a trained professional, community health care worker, a social worker, a nurse, somebody that will go in and develop a relationship with that pregnant person, the pregnant mom, and work with them as they begin to get ready to welcome that new baby home, and then help them in the days following and the weeks following when they do have that new baby home. So you may not know this, but a month, 30 days after the baby is born, insurance will not pay for a return visit to the hospital. It's very costly to return back to the hospital once the baby and the mom have left the hospital. Home visiting can reduce that drastically. So we want to begin the momentum there. We also know that during the pandemic, 1 in 5 pregnant women experience some kind of maternal mental health issue. So this is not, this doesn't ignore neighborhoods or zip codes or street addresses in our county. This is happening in all of our neighborhoods. So the payoff long-term, as Bill mentioned, of investing early decreases the number of children who enter the juvenile justice system. It's early intervention for developmental delays. It's support for families in crisis. It increases parents' parenting skills, the long-term health outcomes, And investing early increases the number of children who are prepared for school, which reduces the cost of remediation and retention. Next slide, please. Just want to point out for you that the Treasury rule was pretty long and dense, but I want to share with you that the home visiting model has been mentioned several times as an allowable expense and highlighted throughout the rule as a means to mitigating the effects of the pandemic for families and children. Next slide, please. In Porter County, we discovered there's about 1,600 babies born every year. It's about 5 babies a day, and I think Porter County can take pride in our sense of volunteerism, our commitment to really strong programs, and there's no reason why we can't develop a really strong system to welcome each one of these babies home, to a nurturing family, to a healthy and compassionate ecosystem. We've already begun to look at what the experience is of having a baby right now in Porter County through a couple of different studies. We're talking with pregnant and expectant and new moms. We've also, the 2 hospitals, St. Mary, who deliver several of our babies from Porter County, as well as Northwest Health, are using the same survey to find out what the experiences of new moms are. Very beginning findings, many moms go into the delivery room not having identified a pediatrician for their child. Several of the moms have told us it's very difficult to navigate the insurance benefits. So with a home visitor, that would be somebody that could help them figure out the ways to make this really challenging and joyful time a little bit easier. Next slide, please.
5 minutes remaining.
Thank you. So our ask is this. The Porter County Community Foundation has already invested and obligated $300,000. And we calculate $500 per family during those 2 years. This is just the beginning, but we realize that this is a one-time request. So we're asking for the balance of that $1,642,000, less the $300,000 for the $1.3 million. As Bill mentioned, the return is high. A recent study that happened during the pandemic, for every dollar invested in home visiting, as much as $5.70 was saved on addressing expensive social problems, child abuse, poor academic performance, unemployment, all of the things that we know challenge our communities every single day. Next slide, please. Again, we want to assure you that we have the capacity to meet those deadlines. The next slide. As set forth in your guidelines.
Yeah, that's it, right?
That's it.
Okay. There's a great deal of research around home visiting, and it's been shown that children who have experienced high-quality or evidence-based home visiting experiences are 3 times more likely to graduate from high school with honors. And health outcomes are significantly improved, as well as dependence on welfare is significantly reduced just through the home visiting, universal home visiting system. The National Association of Counties, it should be noted, is very involved across the country in supporting an initiative called Counties for Kids, and that is a way to support communities who are investing in early childhood. And I think the most important point here is that high-quality early learning experiences like home visiting deliver the highest quality outcomes, not only over the short term, but over the long term. And we believe that this is worthy of significant investment when you look at all of the benefits that exist over the long term. Thank you.
Okay, we'll start the 15 minutes Q&A. Start the clock when the first question is answered. Kurt. I have a question just coming out of the gate here. Would you be willing to accept less if we were to offer less than what you're originally requesting?
Yes.
You would be.
I have a question. I have a 2-part question. One,
you're basing this on 1,642 babies born in Porter County. I'm guessing, from my experience as a trustee, much of my time is spent begging people to come in and get the help that they need. So my guess is that it's not going to be, I mean, just because that many babies are born here, there's probably not going to be that many families who want a home visit, correct? And two, how are you going to reach the families who actually need this the most? Because that's the hardest demographic for us to reach. I mean, the people that actually need this the most are the ones that are the hardest to reach. So do you have a plan in which to do that?
You're going to help us. Mr. Morales is going to help us, and all of you are going to help us. So the real answer,
That's a great answer, Bill.
it takes everyone to do this. We have about 30 partners right now involved in this collaboration. And healthcare is a big part of that. OBGYNs, pediatricians, the hospitals, both of our local community health centers. We know we can't get to 100%, but we can do a heck of a lot better than we're doing right now.
Right? And it is about a culture shift. It's about providing this for every single family so that no family feels like they've been singled out. And this is just how we take care of our families in Porter County.
Assuming that you're chosen to receive funds, where do you all, but let's assume that it's not for the amount that you're requesting. Say you're several $100,000 short. Where do you plan on getting the rest of those funds committed to this program?
Well, we hadn't considered that. Yes, we have. It could be that we have to alter the program slightly to be less costly. There are some funding opportunities on a larger scale, more nationally. There are groups that are interested in funding this work. That's a long road to hoe, but it's possible. And Mary Jane is, through her work, is well connected to national organizations, and you might have some additional.
So several counties, communities, even states, the state of Connecticut is adopting a universal home visiting plan using their ARPA funding. But I will say the national organizations are really looking at the local level and seeing what our interest in investment is here too. So it's going to have to come from all different angles and really kind of, again, looking at all of you for those unlikely sources. But I'm confident we can make that happen.
I've got a couple questions. You talked about how money can come back, like $4 to $9 returns back years later. Well, I don't know how many of our kids stay. Like, I've got 3 myself, and 2 of them are gone. One's in Minnesota, one's in Chicago. So you want to invest the money in the kids, and I guess you're hoping they all stay, but we know they're not going to stay. If that makes sense. Okay. The other thing is, what you're describing a lot of times reminds me of when Head Start started. Kids are at disadvantage. You get them to programs, you get them into read and write and all that better. And the kids that didn't get in Head Start, by the time they're 3rd or 4th grade, they catch up. Now, our school systems are awesome, all of our school systems in Porter County. So, you need to that might be something to look into when your your program is looking at, as I'm seeing it, or as I'm hearing it, if these parents don't get the help with their newborn, the kids are going to be in trouble. But we have other things already in place that are compensating for some of this. That's all I'm saying. So I just don't want to get everyone thinking that if we don't do this, we're all in trouble. But, and we have a lot of kids that do well in our schools, a lot of honors. I don't know. I just had to throw that stuff out because I just wanted to be clear that we've already got some great things in place, and this would be awesome as a supplement, but hopefully that helps you. Or if you have any, I guess I was more comments than questions, quite honestly, but being an educator too, this is where my background is.
I'll try to put mine in a question.
Okay, sounds good.
So how would you differentiate between education or intellectual childhood training and trauma-based or emotional support?
Sure. So, Lecture 101 in neuroscience is that our brain doesn't differentiate between math time, literacy time. Those synapses and those neural pathways are firing all the time. And that's happening through caring and compassionate and relationships with a caring adult. So we don't know when that actually begins, but what we do know is that when children don't have that strong attachment, and that's a social and emotional component that is really important. It's about developing executive function, which we may call soft skills, but it's decision-making, it's memory, it's paying attention. If they don't learn that in those first 5 years, by the time they get to kindergarten, the time is gone. There's no more time to figure that out. For the kids who start behind the 8 ball with that vocabulary gap or those limited executive functioning skills, those are the kids that we hear about from the kindergarten teachers who are taking up all of the time, who are needing lots and lots of resources, being made referrals to special education, and that's where we see that $4 to $9 investment. It's not so much that the kids are staying here in our communities, but we're saving those dollars along the way because they're not getting put into remedial services. They're not being funneled through the criminal justice system, things like that. So it's not about, we can't divide up intellectual cognitive development from the important language learning, the important social and emotional skills that get developed. All of that has to take place in an integrated, holistic way.
And I assume the target population is the population that the trustees are dealing with or discussing. So do you intend to implement something to get into the marginalized population, the criminal justice system, for instance, the recovery systems? Is that part of your plan?
Absolutely. That's been part of the long before I ever came on board with the group here, the 30-plus community partners that are sitting around the table quarterly and monthly for our meetings are really invested in providing this for those families who need it the most. But I think oftentimes we find in Porter County, and we're finding with our study too, everybody needs some help when they have a new little one at home. When we see the rising rates of postpartum depression, 1 in 10 dads experiences some kind of mental health crisis after they have a new baby at home. We're not talking about those kinds of things either. So how do we wrap our arms around all families so that we're not singling out groups that are saying, you have this risk factor, so we're going to help you only. But we're making this part of our culture. This is just what we do for our families here in Porter County.
I got 3 questions, and they're all relevant to our scoring. The first one is, how do you plan on sustaining this program moving forward?
After the 2 years.
After the 2 years.
That was my next question, too. Thank you.
The Community Foundation is committed to this long-term. We cannot fund the entire operation, but we believe that it is valuable enough that we will be able to attract additional financial support.
Does can I follow up on yours? I know
No,
you
go
got
ahead.
some more. Does the 2 years allow you additional time to target funding sources and do grants?
Yes.
And you do have some matching funds here, I see, the $300,000? Okay, and one last question. Have you received, or do you plan on receiving any additional COVID funds for this purpose?
No.
No?
No.
Okay.
The other,
First of all, I just wanted to say you do great work. Porter County Foundation is very well established, and you do some great work in our county. And just a couple, I'm just going to ask maybe the obvious question. This is Porter County exclusive, where these funds would go?
Yes.
Yes.
And you mentioned some statistics. 1 in 5 pregnant women experience some form of mental health issue. That's Porter County? Or is this a national?
That's a national study, but we can extrapolate that. That was coming from the National Association of Counties. They're providing that kind of data to share with our officials as we're making these kinds of presentations.
Because this is a national program. I see it's being implemented in other states, and
Yes.
I see it's worked pretty successful.
Absolutely.
So some of these numbers, are they I was just wondering, are they exclusively Porter County numbers, or were they state or national
It's,
percentages?
most of them are national, some of them are state. And that's, part of the issue as well. Many of you who work in social services, trying to get your hands on that real-time data, understanding exactly what's happening in our neighborhoods. I mean, the trustees, you see that anecdotally coming into your offices, but to really put our hands around exactly what's happening in real time.
Do we have an idea what the numbers are in Porter County for, drug use, mental illness?
It's higher than we want it to be, right?
Okay.
How much time we have?
4 minutes. Could I ask a Vicky question since she's not here? But I know it's
You can try.
questions that she would ask.
Yeah.
I'm going to have to squint when I'm looking at you, but go ahead.
We are talking about roughly a $1.3 million investment. Under the ARPA guidelines, the money, under the county guidelines, the ARPA money needs to be committed or contracted by mid-2024. The bigger thing is, the money has to be spent by the end of 2026. Will that can you guarantee that entire amount will be spent by the end of 2026?
Oh, you bet.
Okay. Because it's not something, because probably what will happen is this will be on a reimbursable basis.
Mm-hmm.
And do you have the capacity to cover things up front and wait for
Yes.
reimbursement? Okay.
Yes.
Real quick, do you guys collaborate with like WIC and First Steps? And then also, how often are the visits and how long do they go for? And if the families are not open to getting a visit at maybe in the beginning, are you guys following up with these people,
Yes.
sometime after?
So, yes and yes. And anyone who's familiar with home visiting as it's been delivered traditionally, it's a longer period of time. What we're proposing is really modeled on what the state of Connecticut is doing, which is a short-term engagement that everybody would receive 3, maybe 4, maybe 2 visits to develop that relationship with a really well-trained, skilled professional home visitor who could then start to differentiate. Aha, here's a family that is eligible for an existing resource that we already have being delivered to families in Porter County. Healthy Families comes to mind. That's one of the programs run by Family Youth Service Bureau. There's an income eligibility, so not all families are eligible for that program. If they're not eligible, where else can that home visitor send them? But having that single point of entry for all families. But yes, we've been working with WIC, with First Steps, with our healthcare providers, the community healthcare centers, all of those things.
And so typically is that like one visit a week? And then also, how long are those visits usually lasting for?
So the model that we're looking at for this particular program would be probably at 45 minutes, maybe once or twice prenatally, 40 to 45-minute visit once or twice after the baby's born. And then there would be this handoff to some other existing resource. So we're not duplicating those services. We're really working to help navigate, to create a stronger system in Porter County.
Board have any other questions?
I've got a couple quick ones. You mentioned the juvenile system. How many of our kids in the juvenile system now are from Porter County? Do you know that?
No, but I guess I would, maybe Mr. Brickner does.
He's Lake County,
I,
right?
Sorry?
You're in Lake County with that, right?
No, not with juveniles.
Okay.
No.
my initial response is, we have an obligation to our society. Even though we're focusing on Porter County, what we do here affects a broader geographic area. And to say that we're not going to do something because somebody is going to leave Porter County in 20 years, we're not going to help them now, is not the approach that I would like to take. I think our commitment to our kids and our families has a broader benefit to society then even if they leave Porter County, we have done society a favor.
Well, I'm just trying to, part of the proposal was to engage with these kids at a young age so that they won't be in a juvenile detention system kind of a thing. My question really was, how many do we have that didn't get the help that are our own in our system versus people coming from other areas? If it's a very small percentage, then, you're asking for a lot of money, and a lot of people are asking for a lot of money, and this is Porter County, kind of thing. So that's what I was just kind of trying to figure out is, if your ask is only going to help a half of 1% of our population, then we need to know that so that the other groups that are coming and asking for, because we've got to figure out a system of who's, all the people coming in front of us and the other committees I know are well worthy of money. And there's 55 million in ask and we only have 28 million to give out. I guess that's where in my mind, I'm trying to figure that part out to where, if that makes sense. So every little piece of information I can get from the need, from what you're asking to our community is helpful to where we know where the money can best be, or the steering committee can take our recommendations and know where the best money should be placed.
Commissioner Biggs' question time is up.
Okay.
I'm gonna allow them to answer that question since it was already on the clock when he was asking it. If you want to answer it, go ahead.
I hate to focus just on the juvenile justice system. I think there are benefits all along the way, and the people that end up in the justice system, the criminal justice system, at whatever point, this is an issue, this is an initiative that helps a lot of different components of the community. Our goal here is not to, sure, we'd all like to put the criminal justice system out of business, but that's not really the goal here. It's a result. It's one of the results of paying attention when it counts the most in the first 3 years of a kid's life. It's one of the results. And if we can reduce the number of people going through our criminal justice system by 0.1%, I had a conversation with a county policeman a few weeks ago who happens to be my neighbor. And I was telling him about this work and how important the first 1,000 days of a kid's life were. And he said to me, I'll bet if I went to the county jail and I interviewed all the prisoners, I could find out what happened to them or what didn't happen to them between 0 and 3 that caused them to be in our system. So it's a result of the work, but it's not our focus.
I think there are other manifestations of that trauma too. Suicide, mental illness, etc. across the board.
Well, thank you very much for your time.
Thank you.
If you have any questions, I'll be around, or we'll be around after the meeting to answer any more questions.
Thank you all.
Thank you.
Thank you.
Board, any questions about your score sheet?
They didn't receive any COVID-19
Do not-
assistance, right?
What's that? I'm
They
sorry.
didn't receive any COVID assistance?
No, they did not. That was their answer. They have not. Do we have somebody from Family Promise here? Just you, huh? You're the whole circus. Come on up here, please.
That's me. I'm a whole circus on my own.
That's right. You'll
Thank
fit
you.
right in.
Oh, all right. Thanks. Makes me feel better.
Thank you.
Thank you.
Did you have a slideshow?
Commissioner,
Yes.
may I ask that maybe you switch? Because I know that I got the slideshow, but I don't have it here on the computer. It'll take me a minute or two if you want to maybe switch and have the
To
trustees.
Portage Center Township trustees? Well, they're already sitting here. I don't know why not, right?
Okay, if you, because I know you sent it, I just, for some reason.
Yes.
it's not-
I mean, they have it in front of them too. It's not.
If you don't mind, no, you're fine. He needs your PowerPoint to get it up online. So I'm going to move you back. It's probably a better place for you anyway, being last. So we'll take on the Portage and Center Township trustees.
Sure. All right. You want us up here
Yes, sir.
in the hot seats?
In the hot seats. We want to be able to stare at you. Such handsome men, you know.
Commissioner Biggs, I am the timekeeper as of now.
Okay,
So
George.
let me know when you want me to start the clock.
Start it when they start speaking. Real quick, you get 15 minutes to speak and 15 minutes for Q&A. And the clock will start as soon as you begin your presentation.
Well, thank you for having us. This is Jesse Harper, Center Township trustee. I'm Brendan Clancy, Portage Township trustee. And when the ARP situation first came out, and we really didn't know what was going on, nobody knew what was going on. I don't think the federal government even knew what was going on. They talked about the trustees being on a committee, and so we got together and decided to be prepared. We tried to do our homework and research with the knowledge that we already had, and trying to learn all the things that are available in Porter County, and ways that we can work together more regionally as in Porter County and not township boundaries. Because unfortunately, for township trustees, there's a lot of state statutes that involve who you can help and how you can help them, which I understand to a degree, but sometimes when you're in situations where at 2 in the morning I get a phone call and it's somebody at Porter Hospital and they're homeless and I can't help them because their address is Valparaiso, just doesn't make sense, or vice versa. It happens to us all the time. So we were also looking at some way of turning this into a regional approach that makes more sense and that we could actually help everybody in Porter County and kind of work as a team. So we reached out and we formed a committee, and we were fortunate enough to have Neo and Gabriel's Horn, Family Promise, Portage Township YMCA, Project Neighbors, Housing Opportunities, and we formed this committee just to try to learn who provided what services, so looking into duplication, looking into how the process works, how many people are helped, and with the intent of having more knowledge when we came here to this committee. So we were very fortunate to learn a lot. It was a great experience. In the guidelines that came out for this committee, the group can either do multiple proposals or submit individual requests, and therefore we decided collectively for everybody to do it individually, with the exception of Gabriel's Horn, because they came to my office and submitted there, so I'm going to give their appeal. So again, working together regionally, serving all of Porter County, not just the individual townships. And as we reviewed all of those plans as a group, it seems that all of them are eligible for the funds as stated in the final rule. Obviously, they're good at leveraging funds. All of these organizations, all are located in Porter County, and they would all be extremely impactful use of the ARPA funds, which is going to be your most difficult decision, obviously. But collectively, as a group, it's all a very good thing, and it's really not duplication when you actually look at those plans and who they assist and how they help, and actually how this will actually help us work together down the road. With that being said, Gabriel's Horn submitted to my office, and so if I could, well, first let me give you the results of of our Homeless Prevention, Diversion, Shelter, and Aftercare Committee. Emergency shelter is basically, I need shelter now. I need it today, and that's where the trustees come in. We are a safety net. We are not long-term housing. We are not short-term housing. We are by statute 1 to 2 days. Try to find you a shelter. Try to get a hold of the veterans programs. Try to we reach out. We do all those things, but we can only house somebody very temporarily. So that's your emergency shelter. Then you have your short-term shelters, which include men's, women's, and children and families for periods of up to 6 months. The goal of short-term shelters in Porter County is to facilitate through referral from local trustees' offices the short-term housing assistance of men, women, children, and families. And actually, when I left my office today, I have 7 cases open in the last week alone, of which 3 are single moms with children that are in the process of being evicted in the next 3 to 5 days.
Plus one more tonight.
Plus one more, yeah. And this is something that we're seeing these numbers really come up right now. It's not something that we saw this impact a year ago or a year and a half, and I think that that's what we're going to see continue and grow as some of these other programs like ARPA and some of those other assistance programs are gone. So that's kind of something that we have to look out for. Back to the shelters, to the short term, it provides proper nourishment while public assistance programs are applied for, provides adequate health and hygiene, assistance with school enrollment for minor residents, as well as transportation, assistant education services such as high school diplomas, GEDs, building trades programs, Indiana Plan, vocational school, college, etc. It assists with job search activities, including applications, transportation, clothing, provides financial services through education, through partnerships with local financial institutions, rebuilding credit, budgeting, providing long-term rehousing assistance through various programs and associated application costs, provides case management and wraparound services, which is something that's extremely important as we get into the end of that short term and into the long term. Providing long-term rehousing assistance with various programs, provides case management, provides aftercare services for a period of up to 2 years after they leave the shelter. And the funding from the ARP funds would help fund these following critical areas, including maintenance and expansion. The maintenance and expansion of existing facilities to assist more individuals and families as possible to help alleviate the immediate need. And a lot of times, specifically Gabriel's Horn, because I deal with them the most, there's a lot of times that we can't get somebody in there. Or we have to put them up in a hotel for 3 to 4 days because it's, quite frankly, usually a domestic issue and things like that. They are in the process, we're in the process when this was happening of adding on to their facility. And with this ask, they would be able to basically double their capacity. The mission of Gabriel's Horn is to provide and facilitate through referral the short-term housing and assistance, provide case management, wraparound services, and aftercare services for a period of up to 2 years. And for more specific numbers, I think we do have Ron here from Gabriel's Horn. If anybody would like to ask any questions, or do you have anything to add?
No, I would just say, when Brendan is talking about regionally, he means county. It's not regional, it's county within Porter County. One of the reasons in which we did this was because when the ARPA funds were announced and then the process was put forward by the county, we were sort of all hands on deck. Because we know a lot of the nonprofits, we work very closely with them, we were afraid that some of the nonprofits we work with wouldn't be able to get a proposal in. A lot of the nonprofits we work for do a hell of a job, but they're non-professional nonprofits, and I don't mean that they're non-professional in terms of they don't know what they're doing and they don't have budgets, but they don't have staff. And they don't have staff to put together a kind of proposal that's needed here to ask for money. So we wanted to make sure everybody had a seat at the table, and we had several meetings over a 6-week to 8-week period when the process was first announced, with meeting the nonprofits within Porter County to find out what is needed, what's being done, and what it would cost. Many of these nonprofits we worked with have also put in asks for ARPA funds with the county. We understand that they've done that, and we were hoping they would do that. We were afraid that they wouldn't, and that's one of the reasons that we asked. One of the things that I always go back to, especially in dealing with homelessness, is, especially in Porter County, is that it is a regional issue in terms of the county. Porter County itself, I have many clients who go from Valpo to Hebron to Couts to Portage, but no one can actually tell you, at least I've never met anyone who can tell you, how we fix the homeless problem in Porter County, because everybody only has anecdotal evidence. People go, well, what we see is X, and what we see is Y, and what I think you need is W, and what I think you need is H. No one has ever come in and done a comprehensive study in Porter County to say, okay, what do we need? Is it temporary housing? Is it long-term housing? Because one of the problems we have is that we have what's called toxic charity, toxic giving, toxic altruism, where we do something because we think we have to do something because we see a problem, but actually, does that create more problems? And so we wanted to bring together everybody and sort of take together all of this anecdotal evidence from people who've been doing it for 10, 15, 20 years to see what they had to say. And I do think, as Brendan said, that many of the people, many of the organizations have put in proposals themselves. We just wanted to make sure if they didn't, we were here advocating on their behalf and what they do. And because we couldn't do our job without these nonprofits that we work with. And so that's sort of what we were doing by putting forward the proposal.
And if I could, I forgot to, I don't think I elaborated.
You still have
really
time. Go ahead.
On the long-term housing.
You have 5 minutes.
All right. So long-term housing model, it's not a shelter, it's a more of a rental apartment building for singles consisting of small, self-contained studio apartments. Each unit of 300 square feet has sleeping, living room, full bath, kitchenette. Monthly rent is at or near $500. That includes their heat, their air, their water, electricity, over-the-air TV, and Wi-Fi. And it's proposed that the funds be allocated for that, and that's in part of the plan that somebody, that Neil submitted. And that's kind of the long-term program. So that kind of hits all three phases.
I'll start out first. Are you able to receive less if less was offered, instead, in lieu of the total amount you're requesting?
You know, we didn't put this exactly in the proposal, but if we receive less, as trustees, I think what we would do is look at the nonprofits that we worked with, especially Gabriel's Horn, who currently have a plan in place, and say, look, we received less than we wanted, other nonprofits put in, who, from our vantage point, who needs it the most and who's doing the most good at this moment, and we would use it in that way.
And I also think that that's more of a question more directed at the individual groups. The only one that I think that I could speak for is Gabriel's Horn.
Well, you're going to have to answer it because they're not here. I mean, everything is based on this interview tonight.
I understand that, but as I mentioned earlier, all the other groups have submitted individual. And because you can't do group and individual, I'm just going to be representing Gabriel's Horn tonight. And their ask is for $300,000.
Okay. That was my question.
Gabriel Horns was asked for $300,000.
For $300,000, and that's pretty close to double their capacity. And next, Ron is here from Gabriel's Horn, if you'd like to ask him any more specific.
Because Housing Opportunities has a claim in for affordable housing up in Portage, both a current going project and a proposed project. Housing Opportunities has one for 2 facilities in Valpo.
They do, and that's all part of this plan.
Right,
And
so
that's-
let's just nix those out. What I'm most interested in is Gabriel's Horn, and I kind of wish you were here separately, but, so is that sustainable into the future, the Gabriel Horn plan? What's your plan? Why don't you come up? You better, because you're the one that knows.
I appreciate it. So my name is Ron Neckel. I'm the president of Gabriel's Horn Corporation. Gabriel's Horn is a women and children only shelter exclusive here in Porter County that we started in 2003, located right on McCool Road in South Haven. So really, with us specializing in women and children only, because a lot of them, as Brennan had talked about, come out of abusive relationships, they have home domestic issues. He gives them a safe haven, somewhere to go to get reestablished, get the kids back in school, get back on their feet, and then we connect them with the community organizations and services to really help them get turned around, become independent, and be able to get back out there into that long-term housing situation where they're stable, they have a job, and the kids are going to school.
Has the pandemic caused more homelessness with women and children, number one? And number two, is there a need for additional emergency shelter for women and children currently in Porter County and specifically at Gabriel's Horn?
Specifically for Gabriel's Horn, yes, 90+% of the time we are full.
What's your waiting list right now?
Right now, there's 12 on the waiting list. That was the last number that was given me at our last board meeting. We do have some turnover, a few that are being relocated into the long-term housing, so it's going to open up at least 3 spots here within the next week, and Brennan's got a list coming in on that. So that has really helped us tremendously.
Do you involve other agencies in your services and in your case management and throughout the county to assist them in relocating and getting their lives together?
Yes, we do. Our executive director, Monica Hammond, handles a lot of that. This is not my full-time job. I'm a labor representative with the Carpenters Union, so I have that. But as president, I handle all the day-to-day, oversee the day-to-day operations, the maintenance of the facility. Currently, we can house 19 women and their children. Under this plan, we'll be able to house 35 women and children, as well as make sure everything's ADA compliant as well, because we do have, and recently had a disabled veteran that some things were difficult for to access certain areas of the facility.
Do you already have a plan together for the remodeling or addition or however you do it?
Yes, we have prints, everything's already been done
Costs,
through the architect.
so it's ready to
We have the
go.
associated costs, yes.
Is it a requirement to be a Porter County resident to enter your, to be stayed in your
For a
facility?
referral through the trustee's office, that we report Porter County resident, yes.
Can you encumber these funds by contract by mid-2024
Yes.
and have it spent by 2026?
We have a plan as soon as the funds become available. We've been able to raise about $35,000 ourselves that we've been, to raise towards us, so it's not 100% that we're asking the county for. But because of COVID, I would say that our donations normally would be coming in for us to be able to steer towards this. That dropped by at least 80% over the last 2 years.
So you have some matching funds.
Yes.
Have you received any COVID funds or pandemic funds?
No,
You have not?
no.
That was my next question, thank you.
And how much housing would you have after you do this expansion? You said 19 families currently, and then how many would you have after the expansion?
35.
35.
So almost double is what we could do.
So you've secured a contractor, and they've given you an idea what it's going to cost to.
Through the architect initially, yes.
and-
And obviously with stuff being, revamped, and that's actually why we had to bump up our ask to what it is, because when we had the stuff drawn up pre-pandemic 2020, everything was written up originally in 2019, and then everything shot through the roof, and then funding dropped. So that's why we've actually doubled our initial estimate of funds needed.
Okay. The board have any other questions?
So to get this straight, so then this is a project that both of you put together through it as a township project, but yet you're going to be working with Gabriel's Horn and our housing opportunities, or is this something separate that you proposed to do together on your own? In other words, we have these separate entities. I'm familiar with Gabriel's Horn, and since I've been a trustee 3 terms, they've always been full. They're behind the ball already. I came into this in the first recession, and this next one coming is going to make the first one look like it never happened. So I thank you for your work. I know how busy you guys are.
Thank you.
Housing opportunities I have used before, or opportunity enterprise, housing opportunities. And again, they're kind of behind the ball. So the only thing I'm kind of concerned, so is this a separate project, or is this something that you would be working with them? In other words, you're going to build your own facility, or is this a facility that you're all going to be working with to build?
Gabriel's Horn is its own facility.
Right.
We as trustees work with all of them.
Right, correct.
So
I just meant like the project, like
Oh, that's
this particular.
specifically Gabriel. That's Gabriel's Horn.
So if we propose to approve the project in the amount sufficient to fund the Gabriel Horn portion of your presentation, would that money go through your office and then directly to Gabriel's Horn?
That is totally up to
Or
the
could
county.
we just fund it directly to Gabriel's
You could
Horn
fund it
as a
direct.
not-for-profit?
I would prefer you fund it directly to them.
And I don't think the money's going to ever really go to,
Well, it's.
they're going to pay out money and then it's going to be
They're gonna pay out and
reimbursed.
reimbursed.
Yeah.
Yeah.
Do you have the ability to do that?
We do, and if need be, we can get short-term loans based on our assets that we hold in order to do that. And I know it's maybe premature to give an idea about it. I mean, is it a 90-day turnaround, is it a 6-month turnaround? That'd be something obviously we'd have to talk about later to understand how long I need to float something or a short-term loan to cover construction costs prior to reimbursement anyway.
Okay. I have one last question. You talked about assuming that you would receive the monies to do you say double the size of the space that you have
Double the
now?
amount of people that we would be able to house, and we're actually able to expand within our own footprint. So we have a large, like 60 by 80 pole barn that's attached to the current shelter used for storage. So we're actually just bumping out into that area to create the extra rooms. There's an extra bathroom there, obviously ingress, egress, they comply with fire hazard, stuff like that. Full kitchen remodel, dining room, stuff like that, so.
It all has to be state approved, right?
Yes, yeah, everything will go through the state, it has to be approved.
And because your operation is doubling in size virtually, what makes you think you could sustain that moving forward?
So we have 2 full-time staff people now, that we have wiggle room on that. Obviously, the largest, for us to be able to go out and get new donations or new money coming in from people to help sustain current operations, is due to the largest cost being the construction. It's hard to hire somebody and incur new employment costs as far as salaries, and also trying to borrow money and make a mortgage payment for this expansion. So if basically that money that would be a new mortgage is eliminated because we're able to pay for it up front, the current funding that we have and fundraising processes in place will allow us to hire another staff person and be sustainable, and continue to be sustainable.
I see, thank you.
And I have one question. So in other words, to boil this down, this will support all 12 townships and all of Porter County.
Yes.
So it's a benefit to us as a whole.
Absolutely. Absolutely.
And I'm sorry, I didn't catch it there. I know that, hang on. How long have you been in operation?
Since 2003.
Okay. Any other questions from the board member?
Thank you.
Well, thank you very much. And I just, before you go,
One Vicky question.
Sure, Vic.
So
Sure.
we are now
Vicky
talking
question.
about a $300,000 ask for Gabriel's Horn?
Correct.
That's what I was going to ask, are we amending
Yeah,
this
so-
now?
Well, what they were asking, no, the 2,475,000 will be, however, they have stated that they can receive, they would accept less. We know through the interview that 300,000 would be great, and that 300,000 would go toward Gabriel Horn.
It's a specific ask for Gabriel's Horn.
Okay.
All the other groups are
I
going
can
to
see
come
why
up
the confusion,
individually.
Mike. I was-
And I get it is very confusing. It's just that, like I said, we didn't know what this process was going to be. We started working on this before everything, trying to get ahead of the ball. And then we thought that it was best for everybody to apply individually, although we applied as a group as well.
But is there anybody else on here that's not going individually that is part of your ask?
No,
Besides Gabriel's
everybody
Horn?
else is on,
Yes, I can verify that.
Yeah. Okay.
Everybody else is.
Okay.
I attempted to apply individually online. At the end of the process, when I submitted it, it kind of kicked me back to the main screen. I thought it went through. I had no idea that apparently the system locked up.
Well, they didn't have anything else to do, so they could do this.
Yeah, so I was kind of shocked when he said, hey, you're not on the list, but that's.
You couldn't have picked two better guys to do it. A very good presentation. I just want to make clear to the other two presenters is that these gentlemen don't vote, so they will not be voting on your presentation or scoring your presentation, okay? They're here as advisors, so. I was wondering if one of you were sitting out in the audience and say, wait a minute, what if they scored theirs?
It's rigged. It's rigged.
Collusion.
Thank you very much.
Thank you.
Okay, next up,
Try this again?
yes, ma'am.
And I
Thank you for waiting, I appreciate that.
I mean, Brendan explained some stuff too, so that's cool. So you'll know a little bit more before I even start.
And your 15 minutes will start on your first question, or you start to speak, I'm sorry.
All right, hi guys, thanks for having me today. So my name's Emily Carpenter. I'm the part-time executive director for Family Promise of Porter County. I started this position in late January, so I'm still a little new, a little fresh, a little green, but I'm really excited to come to you with this today. So today I'm going to talk to you a little bit about Family Promise as a whole, the homeless problem our nation and our county have, and our ask for ARPA funds. Next slide. So what is Family Promise, other than a 501c3 nonprofit? The idea behind Family Promise is a community-based response to the crisis of family homelessness. Family Promise is located nationally in 43 states with 200 affiliate locations, of which we are one, with over 200,000 volunteers and 91 unique individuals were served in 2020. And that data comes from the Family Promise Program Services Report from 2020. There isn't one for 2021. When people ask me what Family Promise is about, at its core, I give them an example of a family with children who has suddenly found themselves homeless. In most cases, the men and women in a family are relegated to separate shelters, kind of like Brendan talked about a little bit. Women go to women's shelters, men go to men's shelters, and most of the time the children stay with their mothers. So if you're a single male that's homeless, where are you supposed to go? This breaks up a family, and unfortunately, that's kind of the best case scenario, is what I just explained, other than the single fathers. As a foster parent myself, I have seen multiple cases where homelessness brought children into care, specifically my care as well, or placed with other foster homes, and that further complicates the situation for people and delays families getting back together. Next slide, I think. Yeah. Family Promise brings together a solution. We shelter families on a rotational basis with local churches, but it's not just about the shelter. Family homelessness assistance includes the things that you see here: financial literacy, health and wellness, transitional housing, family mentoring, child care services, rental assistance, homelessness prevention, and case management. All these things come together to set a family up for permanent success instead of simply just providing them shelter. We also work with other nonprofits in the area, as Brendan touched on too, that help provide some of these things. Family Promise specifically works with churches, and they will in the future provide life skill courses. Every week when a family is at a church, they provide meals, they provide fellowship, and we support the churches and they support the families in that regard. Next slide. Thank you. The 2021 annual homeless assessment report to Congress had this much to say about the problem on a national level. First, individuals identified as chronically homeless has increased by 20% between 2020 and 2021. Chronic homelessness includes individuals who have experienced homelessness for at least a year or have experienced it repeatedly. Many times, but not always, this person is struggling with some sort of issue. Maybe it's a mental or physical illness, a substance abuse disorder, or other long-term issues, or for other reasons I'll touch on in a minute. In terms of Indiana, we are where most of the population is considered rural, which means you live within 10 miles of a really big city. We're in the top 5 for those people experiencing sheltered homelessness, which means they're in emergency shelters or in temporary housing. Sheltered unaccompanied homeless youth, which means children under the age of 18 who are alone, who don't have permanent housing. For example, maybe they're couch surfing. And people in shelters with chronic patterns of homelessness. Next slide. So here's a look at some of the stats of Indiana broken down just a little bit more. Causes for those experiencing homelessness include loss of a job, divorce or separation, family violence, major illness, generational poverty, lack of affordable housing, and maybe other systemic issues. A lot of the things I've personally been told about when I talk to people in the community and people in my life that have experienced homelessness, a lot of their issues stem around medical emergencies, medical debt, or unexpected costs within their current residences, like repairs. Next slide. So this is our county perspective as of last August. So I know that these numbers are dated, but it kind of gives you an example of how many people really need our help. I know that the numbers increased since then, but 31 homeless families with children, 79 children total, 129 adults and children in these families, and Family Promise has 13 host churches to house these families and 5 churches to support and host these families. Now, we have experienced some issues with COVID, so some churches are like on again, off again. Maybe they have sick congregations, maybe they're scared, so those numbers can kind of come and go for us. Next slide. So here's our ask, all of this to say, this is what we're asking for funds for. $10,000 to Family Promise to match a grant that will assist with security deposits or rent buy down for clients transitioning out of shelters. So maybe they need to, they can afford rent that's $800 a month, or they can't afford rent that's $800 a month, they can afford rent that's $500 a month. So we supplement the $300. $25,000 to Family Promise to convert our resource center located at 2637 McCool Road in Portage, which is by the First United Methodist Church, into a static shelter. So people could stay there, they could become part of our rotational basis. And in the following slide, I show you some pictures of the issues that we have currently with our resource center. And then $40,000, kind of like Brendan touched on, the Portage Township trustee to hire a case manager that can be shared with Family Promise, the Portage Y, and Gabriel's Horn to administer one-on-one assistance to families for case management, coordinate wraparound services, and aftercare. All of these things are important in order to help more people in our area become more permanently successful after experiencing homelessness. Hopefully with the help of a caseworker and other nonprofits in the area, some of the services we provide can even prevent some of the homelessness from occurring at all. And we have people in need, and we want to be part of that solution. Next slide. So here are some of the areas that are in need in our resource center. I won't pretend that I know what these things are called, but like gutters and siding and house stuff, right? I'm not an expert. My last name's Carpenter, but I don't know what that is. But it's definitely in need of fixing, right? So next slide, please. All right, so Family Promise is here. Our goal is to empower families and create solutions by building up our community, keeping parents together with their children, and offer shelter and hope. We want to offer people a home. Like, some people don't have a home, and we want to help offer that to them. And this is what we'll do with funds from you. Thank you.
That's it?
Yep, that's it.
Good job.
Short and to the point.
I have a question, though.
I may have an answer.
Okay. According to your ask, it's 75,000.
Correct, yes.
According to your app, it's 50,000.
Why?
Yeah. And if I actually read the content, read the content, it reads 50, so
Okay.
it's correct with here.
Okay.
But that's
Math is
not
hard.
a great big deal. There's a
Well, I
question
think
that-
some of it would going in between, like, the bigger project at hand, I think I just pulled those numbers, so if that's incorrect, I apologize.
If you were offered less, would you take less?
Yes, I think the most important part for us is that we get our matching funds for grants that we already have.
Okay.
And my biggest thing would be that we get somebody, like a case manager here. I'm only the part-time executive director. I can only dedicate 10 hours a week. So to have somebody on staff, even if we're sharing them, would be vital to the success of this.
And have you received any COVID or pandemic funds? None?
Nope.
Okay. The board have a question?
Let's say you get a case manager, how sustainable is that into the future, and whose budget, if you're all sharing this case manager, whose budget's it gonna come out of?
That's a great question. I don't know whose budget
I
that
do.
comes out of.
I knew you would. That's why I
Yes,
looked at you.
the township will pick that up after it gets started. You're looking at our growth rate of 4 to 5% a year. I'm confident that we'll be able to handle that.
What Brendan said.
Now, you guys were talking about doing, changing your facility into a static shelter. Do you guys have a plan in place? Will you be able to have those set in stone by the 2024? And then also?
Yes.
Okay. And-
Yes, we have somebody who's drawn up, somebody came in and did an assessment that said, like, this needs to be done, this needs to be done, this needs to be done. Those are just the 3 pictures that I had to show you, like, the outside. But somebody has come in and said, these are the things that we need to get done in order to make it compliant for people to live in it safely. So that's already done. We just have to find someone to do the work after we have the funds.
And have you given any thought, or do you have a plan on sustaining that moving forward? You know, in other words, how are you going to fund it past this gift of $50,000?
The house itself? So if we have a static location, then I know that the grants are a little bit different that come directly from Family Promise itself. So we'll be able to apply to say, hey, we have a static shelter and we need these funds to maintain it. And those are the things that we can apply to yearly.
Okay, thank you.
And one other, if we allocated a portion of the case management, is there a plan in place to fund the balance of that 40,000?
Yes, it's feasible.
Any other questions from the board? Do you have a question you'd like to ask the board? No?
No, just thank you guys for what you do. Seriously, there's a huge problem here that needs to be addressed.
We get paid huge dollars
I'm
for
really
this.
excited. I don't know if that's true.
No need,
but,
no need to thank us. No, thank you.
Yeah, thank you. Thanks,
Appreciate
guys.
it. Thank you. Well, thank you all for coming. Is there any questions from the audience? Anybody in the audience have a question? No? Everybody's good? Well, that's a good night then.
Commissioner Good? I'm running out of
That's going to
hours
cost you.
here.
That's going to cost you.
Sorry.
No more questions for you.
You were given the scoring sheets
Yes, sir.
by voting members to do your scoring on these.
Yes, what I'd like the board to do is, unless you want to receive them now.
No.
Okay, hang on to them. When we get through this process, we're going to have one extra meeting to go over all the scoring sheets and then pull them forward to the steering committee, so. So hang on to them, do not lose your scoring sheets. Yes, Don, go ahead.
Okay, Dawn, I live in Belleville. For the Porter County Community Foundation,
Don,
yes, can you hear
you can
me?
ask us anything you want.
Okay,
I'd rather have you not ask the applicant.
no, I'm throwing it to you
Oh,
guys.
for us? Okay.
Yeah.
Okay, go ahead.
Yeah.
I'm sorry.
So I mean, these are questions, I guess, will they be billed through insurance? Because I mean, you gotta get money back. How much would be charged? Who would be going to the homes, nurses? And would this become a requirement for low-income families?
The trustees are probably better equipped to answer that question than,
Well, you can't require a low-income family to take anyone into their home or to visit with anyone. That'd be unconstitutional. I think the foundation would pay for it themselves and then be reimbursed when they submit an invoice based upon their allocation. I'm assuming from what we heard from the doctor and Bill that these would be probably licensed social workers and/or nurses to visit the homes.
thank you, Don. Thank you, Don. We are recessed.